So we have a question about platysmal bands and platysmoplasty versus Botox versus both, and maybe facelift or maybe just platysmoplasty all by itself. So the platysma is a muscle that kind of drapes across your neck. In the beginning, it's kind of just there and you don't have those bands when you're younger. Over time, those bands can become a little bit more prominent. A few things can be done for that. If it's just a Botox issue and you just don't like seeing the bands themselves, and there's not really the issue of skin laxity or muscle separation if the platysma hasn't separated too much in the center, sometimes you can Botox those, and that can help soften those, and it can kind of also help with your jawline a little bit in the early stages of going through the aging process. If from a lower face standpoint you're totally happy with everything and there's no issues, occasionally you can do just a platysmoplasty, which is a little incision just underneath your chin, usually in the area where everybody has a scar already from falling and hitting their chin as a kid. Through that, you can access the muscle and suture those back together and kind of anchor it so that it really helps give you a nice sharp jawline. If you don't have a whole lot of excess neck skin, sometimes that can be a great option for you. If there is excess neck skin, it's not really going to address that a whole lot. And so that's where you start looking more at a full lower face and neck lift, which is kind of addressing from here down. And part of that can be doing the platysmoplasty to help with the kind of area under your chin and your jawline, and at the same time addressing the extra skin. So there's a few different things that can be done for the area. Really, kind of like everything we do, it just depends on anatomy and as far as what's going to be best for each individual patient.